Hello, and welcome to the first episode in our Crack the Case series. I am Onyema Ogwadu, an associate professor of infectious disease at Yale School of Medicine. Over the next few months, we'll be posting a series of these short videos, which you can review and hopefully guide you on the best practices to manage the patient presented. This activity is jointly provided by National Jewish Health and Bonham CE. This program has been supported by an independent educational grant from Gilead Sciences Incorporated. Please complete the pre-survey, which is linked below. What is going on with this patient? This is a 70-year-old male who presents to the emergency department with fever measuring at 38 degrees Celsius and 100.5 degrees Fahrenheit, and he reports several days of dry coughing spells as well as tingling sensation in the extremities for 2 days. On presentation, his pulse is 90 beats per minute with a regular rhythm, and his oxygen saturation was 96%. Aside from the fever, the rest of his vital signs were within normal limits. He did report receiving vaccinations for influenza and COVID boosters. However, the COVID booster was updated 9 months ago. And while he reports he has not traveled recently, his niece recently returned from visiting the Southeast United States and had visited with him in the preceding weekend, traveling by air. Now, the patient is sitting up, he appears anxious and is having difficulty catching his breath. You listen to his lungs and there are subtle, fine, bilateral inspiratory crackles, and a chest radiograph is ordered. He also complains of abdominal tenderness on exam, but there seems to be no overt abdominal distension or splenomegaly. He also reports being a smoker. He uses about 6 to 7 cigarettes a day with a history of hypertension and hyperlipidemia. And there is no initial need for supplemental oxygen despite his shortness of breath because of his good oxygen saturation. So while in the emergency department, the patient's tests return and show that he tested positive for SARS-CoV-2. Furthermore, his clinical symptoms worsen while he is in the emergency department, with his oxygen levels dropping to 90% on room air, and his shortness of breath is worsening. Now, in this context, what would be how you approach rating the severity of his disease? And what would be your management plan?